What will I gain from this video? After watching this video, you will be able to confidently identify the trachea and the major bronchi on PA and lateral chest x-rays. Snuggled within the mediastinum are the lifelines that allow air to get into our lungs, the trachea and bronchi. The trachea starts at the larynx and terminates at the carina, where the right and left main stem bronchi begin. This tracheal bifurcation lies roughly at the level of the fourth or fifth thoracic vertebra, or at the level of the sternal angle. As a geometrical structure, the trachea represents a hollow cylinder approximately 8 to 13 centimeters in length. The majority of the trachea lies within the thorax. The average transverse diameter of the adult male trachea is 19.5 millimeters, with a range between 13 to 25 millimeters on coronal and 13 to 27 millimeters on sagittal. The average transverse diameter of the trachea in adult women measures 17.5 millimeters, with a range of 10 to 21 millimeters in the coronal and 10 to 23 millimeters in the sagittal plane. Because the trachea has a cylindrical shape, contains air, and is surrounded by the soft tissues of the mediastinum, it will appear as a vertical black rectangle on the PA X-ray. The rectangle on the PA X-ray will be directed from superior to inferior. The black rectangle on the lateral X-ray courses from superior anterior to inferior posterior. The trachea may curve slightly on both the PA and lateral X-rays, and this should not be mistaken for tracheal deviation. The borders of the black rectangle formed by the trachea may appear irregular because of the tracheal cartilage. This gives the appearance of corrugations. In the elderly population, tracheal cartilage can calcify. This calcified cartilage can help delineate the borders of the trachea. How do we identify the trachea on the PA X-ray? First, we confirm that the patient is midline and is not rotated. Next, we focus our vision on the midline of the patient at the level of the lower neck and the upper thorax. In this region, we identify a black rectangle that is orientated vertically. This rectangle measures approximately 2 centimeters from side to side, which is roughly the diameter of your thumb. We now confirm that this is the trachea by identifying the tracheal corrugations or the tracheal calcifications. How do we identify the trachea on the lateral X-ray? First, we focus our vision to the lower neck and upper thorax. We identify a black rectangle that is orientated vertically but angled from superior anterior to inferior posterior. We now confirm that this is the trachea by identifying the tracheal corrugations. The importance of confirming that this is the trachea is highlighted on this example. Here we clearly identify the trachea by the corrugations. However, between the posterior aspect of the trachea and this line here, we also see a black rectangle, or we perceive a black rectangle. This could be mistaken for the trachea, but in fact, what this represents is air within the lung between the edge of the scapula and the posterior trachea. The lumen of the trachea is visible because of the air that lies within it. If the trachea touches the lung, then the wall of the trachea will be visible as a white line between the air in the lumen of the trachea and the air in the lung. An important interface on the PA chest X-ray is the right paratracheal stripe. This stripe represents the soft tissues lying adjacent to the right lateral border of the trachea and should measure less than 5 millimeters in diameter. On this representative chest X-ray, we can identify the trachea and we can identify this band of whiteness which represents the right paratracheal stripe. Once again, this should be less than 5 millimeters in diameter. The widening of the right paratracheal stripe is one of the most useful indicators of adenopathy in the mediastinum. This is an important area to review when looking at the mediastinum, because this is probably the most consistent area where we can recognize mediastinal adenopathy consistently and confidently. On the lateral X-ray, we can sometimes identify a band of whiteness lying adjacent to the posterior aspect of the trachea. This represents the soft tissues adjacent to the trachea itself and the anterior wall of the esophagus, and this is called the tracheoesophageal stripe and should measure less than 5.5 millimeters in thickness. The right mainstem bronchus measures approximately 2.5 millimeters in length. The right mainstem bronchus gives rise to the upper lobe bronchus and the bronchus intermedius. The bronchus intermedius, in turn, gives off the right middle lobe bronchus and the lower lobe bronchus. The segmental bronchi are not identified on X-rays. The left mainstem bronchus is a longer structure than the right mainstem bronchus, and inferiorly it can course more horizontal than the right mainstem bronchus. It gives rise to the left upper lobe bronchus and the left lower lobe bronchus. Because the mainstem bronchi have a cylindrical shape, contain air, and are surrounded by mediastinal soft tissue, they will appear as black rectangles on both the PA and lateral chest X-rays, similar to the trachea. On a lateral chest X-ray, the mainstem bronchi will look like inferior extensions of the trachea. Because of its more horizontal course, the left mainstem bronchus can be identified as a black circle within the airway column on the lateral X-ray. This is because we're seeing the air within the bronchus end on, and we're getting a summation effect. The end-on bronchus will look blacker than the remaining airways. Now we have confidently identified the trachea and the bronchi, which represent important landmarks. Having this skill, we can apply this by identifying the inferior border of the mainstem bronchus. We can follow them superiorly, and where they intersect, they form the carina. The angle of the carina should be less than 90 degrees. This is an easy landmark to identify and also is a sensitive landmark for pathology within the mediastinum. So in summary, the trachea is an easy landmark to identify on the PA, the AP, and lateral X-rays. The trachea helps localize other anatomy and pathology. The radiological appearance is a black rectangle both on PA and lateral, and the trachea has an undulated outline.